Hello and welcome back. In this video, I provide you a snapshot of the clinical vestibular exam for lesson 7. This is another fan favorite among CCVR participants. It's a bit of a challenge to give you any kind of deep insight into lesson 7 because we cover so much content. What we start by focusing on is the importance of the intake and how to gather essential information. It's estimated that 80% of the information needed to identify potential causes of someone's symptoms is made during that patient interview. And so this is an important time where we're focused on gathering as much information as possible while also creating a safe space for the patient to tell their story. More currently, research indicates that identifying the timing and the triggers are the most helpful versus focusing on the quality of dizziness. It's this interview that becomes such a critical component of our exam. And this is a real challenge for some of you because you may be working with a patient population where you can't conduct an interview, whether it's a pediatric population or a population that has cognitive impairments and they can't express their symptoms. Other helpful components include past medical history, identification of potential risk factors, and categorizing the dizziness, which indicates, is this vertiginous, seeing the room spin, in my head? Is this more of a lightheadedness? Is this more of an unsteadiness? Or in some instances, patients deny both of that and they'll have more like rocking and swaying sensations. But again, this is a critical time to establish trust through active listening and motivational interviewing. And this is quite a clinical skill because we know the importance of gathering as much data as possible. Yet we want to create that safe space for the patient and our questioning. And so we have to find that balance, no pun intended, between open-ended questions, but with our intentions to try to formulate a working diagnosis. The clinical exam will vary among specialties and practice settings. For example, in the acute care setting, the HINTS Plus is important to identify the cause, peripheral versus central, in the acute onset of vertigo when there's spontaneous nystagmus that's present. So many times people will ask, what's one piece of equipment I should have? I'm a firm believer if you're seeing a patient population with dizziness that you need a pair of Frenzel glasses. You need a pair of Frenzel goggles. Now, I'm not saying it has to be the expensive recorded type, but we need to be able to identify whether spontaneous nystagmus is present. So that's in the absence of fixation. You can see on this slide, there's a lot of components. We identify what tests are most appropriate during the intake and review of past medical history. If someone says, I have dizziness, you want to know about the timing of it. How long does it last? How many spells have they had? And what are the triggers? What makes it worse? What makes it better? So if someone tells you I'm dizzy and it lasts a few seconds, but it's upon rising either from bed or a chair and it actually feels more lightheaded, then you may be thinking orthostatic hypotension. But if they say, oh, it lasts a few seconds when I lie down, when I roll over, and yes, it's spinning, then you may be thinking BPPV. So when you can gain the insight of time and triggers of someone's symptoms, it helps you choose which test you want to do. Part of that clinical exam is identifying red flags that require immediate medical attention. So when we think of the exam, we think of the intake, we think of the physical exam, what special tests may be needed, the assessment, what's our plan. But sometimes you don't reach those components. Sometimes you need an immediate referral and you choose not to proceed with the exam that you thought you would be doing. So just to look back at this slide, these are components that are a regular part of our clinical exam. We may not do all of them in every exam, but we're choosing what are the majority of these. If I can do 5 tests in an exam, which one am I going to choose? And that's part of your assignments during the CCVR course is you're presented a case and you're like, okay, what are the next 3 questions? Or if you had a limited time, what are the 3 tests you would do? So we focus on those clinical reasoning skills, which starts the second someone comes in the room and now finished your intake, you finished your physical exam. Now what do? How do you take that data from your intake, from your exam, from your special test, and analyze it and prioritize your findings. You want to formulate differential diagnoses and then think about designing that targeted care plan. Please recognizing that you may not accomplish everything in that visit. It may take multiple visits. It often takes a village, and not just in the beginning of your career, but throughout your career. I'm continuously working with staff where we share case studies, maybe in short conversations on a daily basis, but more formally in weekly team meetings. And this is the reason why we created the 360 NeuroGo community, where we wanted a course that you had lifetime access to, but above all, you had a community where you can ask questions. So within the CCVR course, you can ask each other questions, but as a member within 360 NeuroGo, you have people from all over the world at your fingertips where you can ask questions. And sometimes I've seen these questions answered in real time, where someone has a patient in their clinic asking a question and someone will respond. So cannot say enough about the importance of community. This short video was to provide some insight of what we focus on during the vestibular clinical exam. In the next video, we get to talk about rehab. And in this slide, it just shows you what are some of the indications. We revisit, is this a stable condition? Is this neurological, post-concussion? Is it a functional movement or neurological disorder? Are they a fall risk? Is it visual motion sensitivity? So there's a lot of indications for vestibular rehab. Look forward to giving you an overview of Lesson 8.